healthcare delivery system in this country is changing rapidly.
Right now, we're making that transition going from a volume-based healthcare system to what they call the value-based system. The focus has been on increasing people's access to healthcare.
That means having enough primary care physicians, nurse practitioners, PAs, oral health care is a factor, behavioral health services.
Interest in health workforce has really begun to resonate, particularly of late, around issues of needing to transform the workforce.
My initial vision when I started the Center for Health Workforce Studies here at SUNY Albany was to create a center that could be a focal point for health workforce data collection and analysis, and really a center of expertise and excellence that others, both within New York State and outside of New York State, could turn to get information about the health workforce.
Over the years, I'm feeling that we've become the go-to center for health workforce research, especially in the state, and I know we are one of the premier research centers in the nation.
People talk about looking at workforce shortages and the workforce in general, and the problem always has been when you look at it statewide, you don't get a picture of it in smaller areas. So what we've been able to do is to look at the workforce in smaller units. But the other thing we do is we bring in health status data. So, it's not just about the workforce and the counting, but what do people have? Do they have a lot of diabetes? Do they have a lot of asthma? Are they, if you're thinking mental health, what are the suicide rates? So what we've tried to do is identify some indicators that can actually explain what we need for the workforce.
The center brings a lot of expertise and knowledge around healthcare delivery and how the system is evolving over time, and just more of a qualitative assessment of various trends that would affect the supply and demand for different health occupations. And so the work that they do, I think, has helped to influence how many doctors and nurses and other health professionals do we train, and just better understanding how the different health occupations work together in a team-based environment.
It's not just about kicking out the numbers, but it's taking that next step, analyzing the numbers, telling the story, and pushing it forward so that we can help people get better health care.
Everyone deserves a good chance at health. The health workforce are those doctors and nurses and those specialists that we see. So we need to make sure that those people are there when and where we need them, so that ultimately the people can be served.
There is certainly, at least at the policy level, an acknowledgement that we have to work to increase access to oral health services. And one of the strategies used to do that is changing workforce policy.
We've done some pretty substantive things in a number of states that actually help propel legislation to change scope of practice, to allow dental hygienists to do things that they hadn't been allowed to do before.
Center is funded by HRSA for a technical assistance center. The webinars that the TA Center has put on have been well received by all stakeholders across the nation.
I am continually amazed at the diversity of our audience and at the kinds of inquiries that we get. Daily, we're receiving calls from policymakers, advocates, students, clinical providers, professional associations.
The value of the Center for Health Workforce Studies, I think, is really incredible. Without it, the New York State Health Department, the various schools and colleges would be flying blind, so to speak, and not knowing where we have gaps in services, where patients are not receiving the kinds of health services they need.
I think the real value of our work is that it informs policymakers. The questions that they're grappling with are very difficult, and the issues that they're trying to make decisions about, they're not cut and dry. So they need a lot of information. They need good quality information. They need timely information. And that's what we strive to do.
This is a time of just enormous change, and the center's work contributes, I think, to making that change more effective.
It's clear to me that it's not just about doing good research, but it's also about thoughtful dissemination and making sure it reaches the people it needs to reach.
We're all committed to what we do. Every Thursday we get together and we share lunch together, but we also share more. We share ideas.
The staff here, we've developed wonderful relationships. You know, you really care about the people you work with.
I'm just thrilled to be here, and I love the fact that I'm learning something new every day.
It's a warm group of people. It's clear that people respect each other's skills.
They are responsive, they answer, quickly, and they provide thoughtful responses to questions that are difficult to answer for us all.
Tremendous team, wonderful colleagues. We've done a lot of collaborative work together.
I know that what we're doing is making a difference.
The stuff we do, we see the impact of when we go out into the community, when we see that a provider's been placed because of a shortage area that we helped develop. That means that we're contributing, and I think that's a good thing.
People's lives are made better by our work. They have an easier time getting the services they need. They have an easier time staying healthy. They have an easier time in life so they can enjoy it.
The thing that means the most to me is knowing that we're having impacts on population health.
We're helping people.
It really is a wonderful feeling to have the center celebrating its 20th anniversary. And I do think it's a model for, other centers around the country. And I think it's one of the strongest centers we have in the U.S. So I'm really hoping that it continues to thrive.
Now that we've made it through 20 years, it's been exciting to look back and see how we've grown, how it's changed, and sort of how we've evolved over time. I mean, right now we're in a good position. The quality of the work is great. There's a lot of work to do, and people look to us for answers for a lot of things. So we're really excited about this year, this commemorative 20 years, and we're looking forward to the next 20 years as well.